Hi everybody, I'm Christine Sutherland. I have the delight today to teach you about pregnancy massage and also preparation for labor and delivery. And I have a wonderful couple in Nelson, BC, Canada. And Holly and Rob Vonderlong have wonderfully donated their time and hands-on. And I have an assistant, Hopi Glockner, who's going to help me. Thank you, thank you. So as you can see, it looks a little awkward for Holly right now. That means we have to be on pillow duty. So now that we've got our hands all oily, we're going to handle pillows first. So let's take a bunch of these. And Holly, Rob will give you a couple. Holly, you can tell us how we're going to get you comfortable here. So how many pillows would you like in the back here?
Many. Just as
Okay.
I want to be almost sitting up straight if that's possible.
So Rob, this one could go along the back here. Okay, let's go for that one and let's hope that, okay.
So far,
I
so
was
good.
getting this one a bit higher up for your neck support. Come with me. Okay, try that again.
Yeah.
Just a little bit under the head
That's
makes a
good.
difference.
Yep.
The reason we're propping Holly up, you tell them what the reason is. Why?
Well, because I'm bigger than most right now, I think, and I have a very hard time breathing. And the baby's just big, and it's kind of on my main artery, I think.
And it's the breathing element. Everyone's usually this big when we've only got 3 weeks to go?
2 weeks.
Less than 3 weeks to go. And we're actually not counting on this baby hanging in there for the entire time.
Late.
So I wouldn't be at all surprised if it's any moment now. So the thing to do when someone is uncomfortable like this is always to check with Holly's breathing. Like when you get uncomfortable, we can start changing things around.
I'm good for the moment.
Okay, so what we're doing to begin with, we're going to start with an overhanded palmar kneading. And you use the whole palmar surface. And this is the direction that the digestive system would like to be running. So are you still regular as far as your
It changes.
digestive system? But you're not
Sometimes.
constipated?
I have been at different phases,
Okay.
not necessarily this week. But
So I
it's
am going to
changed.
show the constipation treatment too. So Rob, if you do what I'm doing and just follow around, I'll lift off and you can get on. Yep. And we're going for like the outer edges here. So Rob he's got longer arms than me. He can really reach around. So come further. Yeah. That's good. How's the pressure compared to mine?
Pressure's awesome.
Good.
But I'm just a little slower.
And you don't want to do like really firm pressure. You can just get that baby flipping around. So you just do firm and steady. And then Hoppy, you can hop in there literally. And this is the way that you can work with people so that you've got, I'll let Hopi do a couple and then you can hop back in. So often you've got more than one friend around, Holly, so that if Rob was massaging you, or say we're on the birthing team and we've got labor and delivery happening, we can alternate. You know, just like this, we can have 2 people on the job. And Hopi, you can hop off, and Rob, you can hop in. So that kind of thing is a really good way to teach people too. Sometimes people can't get it because we're opposite. You know, we're going to be mirroring each other. So what I do then is I'll come around and sidle up to Rob here. And then what I'll do if he wasn't, doing what I thought, can you put your hands on mine? And I just take him for a ride. So the trick is to keep this one on all the time. So that's what I do. So Hope if you're teaching when one hand keeps going round and round, and then that hand hops over. So then people get the idea.
And so I'm already starting to feel like it's too much pressure. Yeah.
Okay, so let's change and let's see what happens when we do this. So too much pressure lying down.
Just the weight of myself, not anybody else.
Okay.
The pressure feels really good from everybody.
So let's do, if we lift up a bit here, does that ease anything?
Well, I'm
With
feeling
upward
it mostly
pressure?
just down low, right? in
Down
the
low?
middle.
Okay, so you'd be better on your side? Okay, so we'll get back to this because we don't have to do the whole thing at once. Do you have 30 seconds to follow around?
I can do 30 seconds.
Okay, Rob, there you go. Hopi, come on in. So we're going to do this fingertip kneading. So it's one set of fingers on top of the other. We're going around in the same corners. Well, we've got our mom breathing away. And the places where we emphasize are the 4 corners. That's where things slow down. That's called a flexure. And then down this side is how people get constipated, the weight of the baby in here. And we emphasize right down here, this corner. And all up this side. And you can do it from your same side too, Rob. You can get right in there. And anything you can do here, and then I do this running vibration. So I'm going to come up, yeah, and we can go that way now.
The baby must really like this. All this attention.
And sometimes it's a counter irritant, like it just can, because we're moving things around, it can keep you in that spot for just another
Yeah,
minute
it
or so.
It does actually. It kind of moves
Are
the
we
weight.
going all the way around with this?
No, you can for sure, but you really emphasize this side. It's kind of a running vibration and a bit of a shaky movement. But it really gets things disturbed in that corner so that there's a stronger peristaltic reaction to get things around the corner and out the rear end. Okay, can I throw in a respiratory one while we're here?
I think so.
So we're going to go down, and you might want to get a high shot for this, Chris, because I'm going to start right here in the very center, and that's where the xiphoid process is. I'm going to come along the edge of the ribs, the costal angle, and that will get me that big muscle of the diaphragm. So Rob, if you want to angle in there, and you need to kind of step back a bit, and then Chris, just go wherever you need to see what he's doing. This might be a good angle here. Nice. And you can follow it more around that way. It's really hard to feel where the ribs are going. Yeah, and then go slow, half speed. Yeah, that's it.
I'm starting to kind of feel the pressure again.
Yeah, and more under. Okay,
Yeah.
hope you hop in. And we're gonna go for that fingertip stuff again. You got it. Yep, right
How's
under.
this pressure? Is this...
Great. Everybody's pressure's
Good.
similar and really good. Yeah.
So let's go for rib breaking and see if we can ease up anything for her,
Are you
okay?
gonna be okay?
Do you want to try one?
Yeah. I just kind of come in phases where I'm like, I can't breathe, and then I feel
How are you doing now?
okay.
We're in the
this side.
can't breathe.
I guess it's when you pull up too,
Yeah.
and the shaking does take the pressure
It
off.
does for sure. It just lifts that kid off. So Rob, it's easier for you. You can reach right over, and we've got too much oil on her, so she's a bit slippery. But you want to get in that groove right there, and it's a rib raking. And I'm just gonna pat off some of that oil. We're gonna tea towel off some of this. I think you'll get a better grip. Does that feel like you can open up? And make a bit of a claw. There you go. And then come down here. So if you can go way over there and grab around and then lift her. There you go. That's it. And you get that claw like, how's that?
It's good. I think I have to actually really turn
Want to go
over.
to that side?
To turn?
Yeah.
Yeah.
And so, good. That was good.
Are we gonna take this?
Yeah,
Yeah.
take that one out. And then this one, you can hug. There we go. Yay.
You're warm enough, Holly?
Yeah, I'm fine. Thank you.
And Holly, can we pile pillows between your knees?
Absolutely.
Okay. And that one.
Is that good?
Yep. Okay, and then the most important thing at Holly's stage here is to have this foot higher. You know, even though she doesn't have any swelling, she's a bit unusual that way. But just the more we can get that foot actually above the heart, the better. So we're going up in the world here, Holly. Good,
Yeah,
and
that
down.
feels great.
So that just eases up the tension in the hip too.
Totally.
Okay, so we'll do mostly from this side now. So if you guys come around here, we'll start with the effleurage, and we'll get, and you won't need much because there'll be 3 of us lining up for this, so just a little bit is going to go a really long way. Great. Okay, so what we're going to do is we'll do the up and down effleurage, Rob. So I'll go up like this, and Holly, you can take my spot. I mean, Hopi, sorry, you can take my spot. And then Rob, you can come on down this way, yep. And really get that, if you can get the posture here to show, Chris. So you want the front leg forward like that. And then Rob, you can go down as it's coming up. So, yep, there you go. Just down the center. And then when Rob's coming up the side, you can go up the top. There you go. Yep. And then when you're coming around, Rob, pull up around here. And then you can start again. Great. And And it's great. Your hands take up a lot of space. And when you come around the side, you can actually tuck right under. So the more pull up we've got up the sides of her, really, that's perfect. So you get that posture of how they've got their legs in front for pushing. How's the pressure, Holly?
Great.
It's good? Great. Okay. So Rob, I'm going to let you go down, and then when you come back up this time, let's do the ringing. So if you ring up here, and Hopi, if you ring down below, again, you've got this stride posture for their legs here. And as long as you've got people striding, they can't mess up their back. Especially Rob's got a really long back, and Hopi, you've got your basic standard long legs, so you can really wrap and let your fingers wrap right around like Rob's, and then just keep all the fingers together, you guys. Yep, that's good. Yeah, and then you can go a little lower on the lower back, Hopi, like get the sacrum. Nice. And then we can start with this alternate thumb kneading. This is the meat and potatoes of the massage. And this, what most people do is they flip their thumbs. So if you can keep the thumbs glued down on all times. And Holly's got a really strong back, but the erector spinae that go from here all the way down to here are the ones we're after. So especially the lower back here, all this sacrum right there, that's our point of interest, because that's where the more you can work around here, the easier it feels that the baby's carrying in all the way around to the front. So if you folks work her up here, and Rob, if you take upper and Hopi, you take lower, is that touchy right there?
It's good.
Okay,
No,
great.
And so Christine, we're working
across it. So
we're
instead of
going
working
across,
along
but
this
we're
way,
kneading up.
yeah, you're kneading
okay.
up. So you make it more elastic by just working across it. And that alternate thumb kneading comparatively, Holly, are they the same kind of pressure?
Yeah.
Looks good to me.
Medium firm, feels good.
Yeah, great. And you both have your thumbs glued down, which is unusual. You know, most people have flying thumbs. One hops off the other. And as they're coming up and down, where does it feel like they should focus? Like, should Rob stay in the shoulders in certain spots?
Oh, which one's raw? This one.
That's a good sign, Hopi.
Yeah, actually, I did. I thought that was
hands.
so.
Hey.
Yeah, right in kind of the lower back, just right in that area, and then right in the shoulder are some major spots.
I'd say we got the dream team. That's very good. That's good.
Oh yeah,
And try
they
one,
both got the spot
two.
perfectly.
1, 2. That's good. Yeah. Are you in heaven?
I think I'm in heaven.
Great.
Yeah, that's
Not
right.
necessarily like a nerve.
No,
It
you
does
both
feel-
are on
I got a knot.
this major spots. You're good.
And I'm going to move them along, unfortunately,
Oh.
because I'm going to show them how to do a variation on that. So that, Rob, I'm going to have you come up here so that you
Oh,
can
that's
get
good.
right in there like that.
Oh my god.
And work out to the shoulder. And there's very little room, and you've got very big hands. So it's not going to look as easy as what I'm doing for sure. But try that. I'm going to undo this, Holly.
Yeah.
So we've just got a little bit more access here. There you go. Yeah. That's it.
Oh, that's awesome.
Okay, and I think maybe what we could do too, try this one down in this.
That doesn't feel
Doesn't
right
work,
for
does
me.
it? Because what I do sometimes is I've got in
Right.
here, or I think you're best there.
Yeah.
Nice. Good. And with you being efficient, the only thing I would suggest is just a little slower. But you got the stroke down really well. And then I'm going to show, and I think even over the shoulder here, Chris would give a really good idea, because you can see how his hands fit in there. And then try 1, 2, 1, 2. Oh yeah. That's called stretching.
I knew that.
Let me show you how you can modify that too, because you can get a ringing kind of thing, like that kind of thing. But if you could do one of these, because it looked so good, and then we can get a close-up on that, then we can show how somebody with huge hands gets in there. Yeah, and then just go slow. Yay. And then I'm going to show for Hopi here how to do, if you go this way now and work all around there. Doesn't that feel great, Holly?
Yes.
And there's something about this kind of angle, okay? And then I'll switch you guys up. So you can work all around there. So Chris, if you could see over the shoulder. No, you had it right the first time. That gets you closer to the table. Yeah. And then you can get a bit more on the tips of your thumbs instead of on the side. Yeah. But you don't have to push as hard because you've got your posture of the weight of your body behind you. Perfect. How's that, Holly? Does it feel like mine?
Mm-hmm.
Great. And now that you folks are really comfortable doing those, I'm going to switch you up so that you get good at both of those. And I've just got, great, nice. And remember the triangle here is these little kind of subtle dumplings. What are they? Dimples, thank you. The D word,
like
dimples.
dumpling.
And we're going to go down, like really where this starts is the triangle of her sacrum. So we want to go along each of those angles. So this is going to be the lumbosacral joint along here. And these ones, this is going to be the sacroiliac. So the same way we're working across the erector spinae, if you work that upper side along here, they'll follow you anywhere. Like it's just so relieving to work all along there. So try that angle. It looks imaginary and you actually can't even feel a ridge because she's so well padded. Like she's got very strong gluteals and they're attaching and they sort of cover it up. But the person on the receiving end, they can always tell you, and when she's in labor, Rob, this is one of the areas that they'll tell us exactly where to go and how long to stay there. So then you can switch Hopi and you can do shoulder, and Rob, come on down here and I'll show you the game plan. I'm just going to tuck this in a bit, Holly. And then we can go right from here and like that. And you get this kind of lean into it that really helps, even though you are much longer and stronger than me. That kind of lean into it, yeah. Yep. And you've got room here to spread out this way, so put your hands on mine, Rob. I'll take you for a ride. So they're just a bit more out. That way your thumb is leading. You're good.
Okay.
Yay. Yeah. And again, the more you can swivel those out, the better. Yeah. But it's so much easier than Rob because you got teeny little hands, right? She's got.
Well,
She's got a grip on.
He's got no,
Is that better? More subtle. He doesn't have a claw-like grip up your rear end.
Well, he did.
We're good. Looks good now. It's called concentrating. He was concentrating on his thumbs. That's it.
Yeah.
And if you think of pushing up and out, that's great. But you've got such big thumbs that if you get more on the tip, you'll get more. Yeah, that's it. Do you feel the difference, Holly?
Yes.
When he gets more on the tip?
Yep.
And then you can really track across there too, Rob. That's great. And you two are like opposites. You've got the teeny little thumbs and Rob's got the big ones. So that's, yep, great. Okay, and then you can do it traditionally this way too. So you can work like that. Or you could work even closer. When I get closer, I kind of wedge my elbow in because you might not have a lot of room like this to stretch out and work in like that too. So try that. This time right on the flat of the sacrum, like right in the middle there. Yeah. How's that, Holly?
Great.
For pressure?
Yeah.
And I'm doing all the checking in for you folks, but that's, keep checking in and see how she responds.
How
Great.
does this feel? My pressure up here.
That's good. Yeah.
Am I doing sort of a similar thing? Or?
I think so. Are you
Oh,
going?
yeah.
You're going out, right?
And with
Am I-
your
It's
little
that out
hand,
that feels really
you can
good.
get it in here too.
Okay.
So try this where you just come around this way a bit, and then that slides under, and then you can get in there.
shimmy around this way.
Yep. I'll take you for a ride. Hope you come with
Okay.
me. Okay. So we're going to go up around here like this,
Okay.
and then we'll go down like that. And then here, this is a very light touch on her throat. So try that. Yeah. So, but it allows you to get your thumbs down there. There you go. Do you feel that? So that the fingers are there, but they're not doing any pressure on her throat. How's that? Non-choky?
Yeah.
Good breathing?
The best that can be expected.
Good work, you guys. Yay. Okay. So, Rob, do you have any favorites? Like when you're massaging Holly? Not Hopi, Holly? When you're massaging Holly, do you have favorites that you know she really likes, so you just go for that? Like say you only have a couple of minutes?
Oh, I can know his shoulder.
Okay.
His shoulder is sore.
So go ahead, you do the shoulder.
And the
And we'll
movement
just-
is pretty, it's the meat and potatoes movement, so it's pretty, I can do it for a fairly long time, I think, compared to other.
Rob looks like he knows where he's going there.
He knows the spot.
You've had a good director.
This is the spot.
Yes.
There's always a knot in here, you can see it.
And this is a wonderful bonus so that Rob has a pretty good instinct for where Holly's sore spots are, which is really great to get the feedback. So don't let them fall asleep because you want to be saying, is this exactly where I'm supposed to be? And that way she comes to the surface and still gets a whole lot of relaxation. Rob is a musician. I don't know if that's his excuse for being so good with his hands, but he has quite a gift for being able to massage. So we're lucky that he's got his design up there. And the only thing we're always coaching Rob about is just slowing it down, which is very typical for most people. They get a little efficient, and I'm the only slow one.
But the
good.
slow is nice. It's really much more calming. You can really relax with that.
Good point. And also you have more control, and you're not as superficial. The slower you go, the deeper you get. Okay, so with